I'm Dwight Drummond. Tonight, pharmacies are given the go-ahead to start COVID-19 testing.
We're going to ramp this up and take the load off the public system that we've seen over the last 10 days, 2 weeks.
A handful of pharmacies are supposed to be testing starting Friday, but many are already telling us they won't be ready. But first,
the government will make a significant, long-term, sustained investment to create a Canada-wide early learning and childcare system.
The Trudeau Liberals lay out their plan for the pandemic and more as the Prime Minister gets set to address Canadians. Justin Trudeau's government is promising more help for Canadians affected by COVID-19, saying now is not the time for austerity. Those words from Governor General Julie Payette as she delivered the Liberal speech from the throne. And as Hannah Thibodeau reports, the speech set the stage for billions more in spending.
The theme of this throne speech was clear even before it started: face masks, elbow bumps, and physical distancing. An event that is always standing room only. This time around, there were only a limited number of guests allowed.
To overcome a pandemic requires the work and resolve of every order of government, of every community.
The number of cases is rising in many provinces, especially in Ontario and Quebec, causing long waits for people to get a COVID test.
The surge this fall further reinforces what we already know, that we must do even more.
The government says it will create a federal testing assistance response team to help with the growing testing needs, including in remote communities. And after months of spending billions on pandemic programs,
this is not the time for austerity.
And with that, the government has promised to spend more, including extending the wage subsidy until next summer. This is a program that helps eligible businesses cover 75% of employees' wages. And the extension of that program is a part of the plan to create 1 million jobs, with the hope to restore employment to pre-pandemic levels. A task force will be created to help women get back into the workforce.
We must not let the legacy of this pandemic be one of rolling back the clock on women's participation in the workplace,
including a sustained investment to create a Canada-wide childcare system, using Quebec as the model, a model that has the lowest costs in the country. And to address some of those shocking conditions in long-term care homes that were exposed by the pandemic, the government is promising to create new national standards, and it will impose penalties for people who neglect seniors in their care. This is the Liberal government's roadmap for going forward, but whether it actually happens or not depends on a vote of confidence that will happen in the coming weeks. Hannah Thibodeau, CBC News, Ottawa.
So what is in the throne speech for us? Toronto and the GTA have been particularly hard hit by the pandemic and its economic fallout. Chris Glover looks at what the federal Liberals are promising for our region.
The details are far from worked out, but even the idea of a national childcare program has piqued the attention of many Torontonians.
The responsibility on childcare has increased tremendously. I think all parents can use that additional help.
The question is how much and will it be meaningful?
I could afford childcare on my own, but I understand that there are families that might not be able to.
This is not the time for austerity.
The childcare announcement was a key plank of the Trudeau Liberals' throne speech.
This is our generation's crossroads. Do we move Canada forward or let people be left behind?
Ontario's Chamber of Commerce says there'll be a ceiling as to how much the feds can spend, but definitely supports a national daycare plan.
The longer this goes, the less money is going to be available for anything else aspirational.
With so many people out of work from the pandemic, the Canadian Centre for Policy Alternatives was hoping to see more specifics about the transition away from CERB.
We in the Chamber movement would prioritize that incredibly high because it is a fundamental instrument, not just of equity, but of economic productivity and participation in the workforce.
People are going to end their CERB in 4 days, and then they'll maybe look for these benefits, but there's no legislation yet to put them in place. And so what I thought might have happened would be 1 month extension of CERB to get all this in place. but it doesn't sound like that's going to happen.
The Liberals also promised money to end homelessness and enhance the first-time homebuyers plan.
The government will also move forward with enhancement to the first-time homebuyer incentive, including in Canada's largest cities, so family can afford to buy their first home.
Plus, specific industries like hospitality and tourism will get targeted support, and Toronto may even get help with the multi-acre park over the rails downtown.
And then I heard a couple of other things that were perhaps even more localized to Toronto. I heard a commitment that talked about the assistance of the government in forming new urban parks, which could be applied to some of the work we're doing with ravines or with the rail deck park.
After picking up every seat in Toronto, Mississauga, and Brampton in the 2019 election, today Trudeau really kicked off his campaign to try and win them again. Chris Glover, CBC News, Toronto.
And stay tuned. In about 20 minutes, we will hand things off to CBC's chief political correspondent, Rosemary Barton, as Prime Minister Justin Trudeau speaks to the nation about the throne speech and the coronavirus pandemic. Stay tuned for that at 6:30. Ontario saw 335 new cases of COVID-19 today, and with growing concern about long wait times to get tested, the Premier rolled out another part of his plan today to fight the disease's resurgence. Starting Friday, dozens of pharmacies will join the list of places where you can get a test, but as Lorenda Redekop reports, it's still unclear how many will actually be ready.
Starting Friday, up to 60 pharmacies in Ontario will offer COVID-19 testing.
Pharmacy testing will be by appointment only for people without COVID symptoms. And screening will be done to make sure people looking for a test are asymptomatic.
You'd likely receive a call prior to coming into the pharmacy to verify your asymptomatic status, and you'd be given directions at that point in time as to where to go within the pharmacy once you arrive.
In the past few weeks, there have been huge lineups at testing sites across the province, with stories of people arriving at 3:30 in the morning, others being turned away after waiting for hours. The Ontario government says the 60 pharmacies will help add up to 3,000 tests a day to the provincial count.
We're going to ramp this up and take the load off the public system that we've.
But it's unclear how much pharmacy testing will actually start on Friday. We called to a dozen of the Toronto pharmacies that are on the list, including this one behind me. It's one of 7 where they said they won't be able to start either because they don't have the supplies or they still haven't been trained. 3 others said they still don't know yet. And then one in Scarborough said it will open and it's already fully booked.
I think it's amazing. I would do it. Yeah, I had done it at the hospital. I would rather do it like at Shoppers.
It's very local and accessible so that not everyone is having to congregate in like the few hospitals around the city or like the few clinics.
More testing could add to the challenge that already exists with lab capacity for processing the tests. The backlog has grown. In question period, the opposition quoted a social media post from the head of the Ontario Hospital Association.
The hospital sector labs cannot sustain testing under these conditions. The system is heading for a crash.
The Premier says they're working on it, including looking to private labs.
It's all hands on deck. I'm talking to pharmaceutical companies to see if they have any additional lab technicians, and we can train them up. We're reaching out to the universities.
So the information we've received to date about the logistics is that pharmacy samples would go to a centralized location, which is separate from the existing COVID testing centers.
Details of the next phase of the province's 6-part COVID plan for fall are expected to be released tomorrow. Lorenda Redekop, CBC News, Toronto.
Some of the country's dentists say they want to help in the fight against COVID-19 by providing testing at their clinics. If the plan goes ahead, it could divert thousands of people away from busy testing centers. Greg Ross explains.
With COVID-19 cases on the rise and the need for testing on the rise, the Ultimate Dental Association says, why not kill 2 birds with 1 stone and get tested when you go for a routine dental checkup?
There's 5,500 dentists in Ontario and 14,000 hygienists. Typically, they work in teams and see about 20 patients a day. That's 100,000 patients a day that we can test.
Dr. George Christodoulou is the co-CEO of Ultimate Dental. He says that level of testing could go a long way in reducing lines at testing centers right across the country. And he says dental centers already have protocols in place to be able to handle this kind of testing.
The PPEs are already being used. The dental teams are already prepared in a safe environment. Patients are coming in. As long as they're asymptomatic, we can take care of them, we can treat them, but we can also test them.
He says it would also be safer for asymptomatic patients.
Patients actually, think about it, they have to go to the hospital. They go to the hospital. They don't necessarily need to be there. And they're going to areas where there could be other sick people. Whereas when you're coming into the dental office, you're coming asymptomatic and you're coming into an environment which is protective.
Christodoulou says if they can get the support of either the provincial or federal government, they could get the plan up and running quickly with minimal training for dentists and hygienists.
We would add it to the protocols that we already have. So we'll probably have to train our people to do it correctly and properly, and I'm pretty sure that we'll be able to get there.
He says they've reached out to health officials at both levels of government, but have yet to hear back. Greg Ross, CBC News, Toronto.
City of Toronto officials are asking people to think about changing their plans for Thanksgiving.
I encourage you to talk to your family and make a clear plan in advance on how to mark the occasion of Thanksgiving in a way that limits in-person contact with others from outside your home.
Dr. Davila says she's concerned the upcoming holiday could drive the spread of the disease. Also today, the mayor says he's asking city staff to look at the possibility of cutting back bar and restaurant hours. He also wants to make sure more people are wearing masks when they're at their workplace. Tory says the city is looking at further limits on gatherings and at making city properties available for COVID-19 testing. Peel Region's top doctor says the average contacts for each person who tests positive for COVID-19 has increased sixfold from 5 to 30, suggesting residents are letting their guards down.
This means more complex investigations, higher risk of transmission, and it also means that precautions are clearly not being followed. Now that we are seeing a resurgence in our community, we need to fix this.
Dr. Lowe says Peel has not entered a second wave yet because officials can still trace most cases back to a known exposure or source. He is urging residents to stay vigilant and consider canceling social gatherings and shrinking their personal bubbles. There are currently 779 active cases of COVID-19 in Peel. The post-tropical storm Teddy made landfall in eastern Nova Scotia this morning. Teddy brought strong winds and heavy rain, knocking out power to more than 15,000 customers in the province. Many schools were closed and public transit was suspended in some areas. The storm hit Nova Scotia hardest, but its effects were also felt in neighboring provinces. And Colette, you have been keeping an eye on Teddy, haven't you?
I have been, for sure. We've been watching this very carefully. And part of the good news in here is that there were many areas of Atlantic Canada that could actually use some rainfall in there, and also that it moved relatively quickly through here. So it wasn't as bad in some ways as they thought it could be. So nice to see this here. Now, essentially, it's off the west coast of Newfoundland at the moment, post-tropical Teddy. And we are looking at some of the waves, though, here, about 17 meters just off of Port aux Basques. That's what's been reported most recently. Now, there were some areas in Nova Scotia that saw over 100 millimeters of rain, but Halifax, 60 to 90 reported through there, and parts of PEI, 50 to just over 70 millimeters of rainfall through those areas. So again, there were some areas with a drought this past summer, so picking up some rainfall that they could at least use. Temperature trend for us continues to be warm after just such a beautiful day today. By Saturday, though, we're going to find the humidity going up a little bit, and by next Tuesday, things are going to go in the other direction. Temperatures cooling down. Just giving you the heads up. That's quite a string of days we've got that we're going to put together until then. Our afternoon temperatures up to 27 degrees. Hamilton 26, St. Catharines 27. Current temperatures just coming down a little bit, so still a really nice evening ahead. And we're going to see clear conditions now through the overnight. A little bit of patchy fog is possible, so just know tomorrow morning that could be lingering a little bit with some reduced visibility. That will burn off pretty quickly. But what's interesting is as we go through the day tomorrow into the afternoon, picking up a little bit of cloud cover. We start off with sunshine, And then a few isolated storms may pop up, pretty isolated, but still there's that risk, so don't be caught off guard. Friday, though, back into the sunshine, full sunshine, and through the period, temperatures still running about 5 degrees above seasonal. Overnight tonight, mild conditions, double digits for those overnight lows, so it's not a bad start tomorrow morning. And then this is where we're going with those temperatures into Friday. Saturday, though, it's going to start to feel like we're in the low 30s with the humid X values. And towards the end of the weekend into the beginning of next week, looks like we'll pick up some shower activity coming back at us, Dwight.
And we thought it was all finished, but we're getting a second wave of some heat.
Yeah,
Thank you, Colette.
the beginning of fall looking very good.
We will take it. Thank you.
You're welcome.
A Newmarket hospital plans to cut nearly 100 nursing positions early next year. Now, with rising COVID cases and the flu season coming, the Ontario Nurses Association says this couldn't be happening at a worse time. Alicia Son has the story.
With South Lake, what we learned today is that there'll be a reduction or a cut of 97 registered nurses.
South Lake Regional Health Centre in Newmarket sees about 22,000 inpatient and 600,000 outpatient visits each year. But the large hospital, with its research and specialties, provides care for over 1 million people annually. The Ontario Nurses Association says losing so many nurses would be devastating.
Nurses work on average 2,000 hours in a calendar year. So just, doing the math, it's about 170 some odd thousand hours of registered nursing care that's being lost at South Lake Hospital.
South Lake's official response characterizes the cuts as more of a shifting or refining of services while balancing their budget.
I'll get you some snacks.
And in their place, they say they will add 49 registered practical nurse positions, as well as 29 of what they call patient services partner positions. Quote, given the number of current and potential future clinical vacancies we have, we are hopeful to avoid any frontline involuntary employment loss at South Lake. The spokesperson cited a financial deficit.
If it is a budget problem, then the government needs to step in and do a careful review or audit of those books.
We asked Ontario's Health Minister's office about this, and they said South Lake received $5 million in funding this year, and so did Lakeridge in Durham Region, which also has plans to lay off nurses. Quote, hospitals are in charge of their own operations and operational decision-making, and the government will continue to work with South Lake Regional Health Centre and Lakeridge Health to understand their system's needs as we continue to battle COVID-19. But the nurses union says timing is critical. We're trending towards a second wave of COVID-19 infections and flu season. And while these cuts wouldn't come into effect until February
will be here before we know it. It worries me that this is what we've seen today at Lakeridge, and we'll see more in the next few weeks.
Ali Chiasson, CBC News, Toronto.
Many economies around the world are suffering because of the COVID-19 pandemic. But just how much is our city suffering? We'll get a closer look at the numbers for you coming up after this short break.
The weather is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. It's hard to stop a train.
Toronto police say they handed out more than a dozen fines last night at almost $900 each at a house party in Scarborough.
Hope the public gets the message. We're directing our members, the education phase, it's over. The warnings are over. We're taking a very aggressive approach and charging people.
Officers say about 50 people gathered at a residence near Kingston Road in St. Clair. They handed fines to 14 people. They're investigating the origin of the party and say a $10,000 fine isn't out of the question for the organizer. Police add they also arrested a wanted man. He was transported to the Halton Police Service. We know COVID-19 has blown a hole in the city's finances, and tonight we're getting a better sense of just how bad things are. Toronto is now counting on major emergency funding in order to avoid tax hikes or service cuts. Nick Boisvert now with the details.
Like the local economy and perhaps your social life, the City of Toronto's finances were absolutely walloped this year, and the city now has a better idea of just how bad it's been. Let's take a look. Toronto expects to lose out on $1.9 billion this year because of COVID. That's thanks to things like lost ridership on the TTC and increased spending on shelter and housing. But the city has also saved about $550 million because of measures like reducing spending in other areas and temporarily laying off workers. Still, the COVID shortfall clocks in at about $1.34 billion. The city says it can't climb out of that hole on its own. There could be some help coming.
Our government will invest over $19 billion to ensure the provinces and territories have the support they need.
The provincial government is now distributing that money to municipalities. So far, about half of Toronto's shortfall is supposed to be covered.
What this report also does is shows that there is still a need out there.
The committee would like to acknowledge that.
Today at City Hall, Toronto's executive committee heard a report on the city's finances. Councillors are now waiting on further funding, which could help the city avoid last resort measures to make up the loss.
In a time of COVID, the last thing anybody wants to see is any government raising taxes. So we're confident that we have shown that. And then the services that are being provided, whether the frontline services or service to residents across the city, we need to ensure that we continue to do that.
The provincial government tells us they are committed to helping municipalities like Toronto with further funding, but it might take until next spring before the city knows exactly how much money it will receive. Nick Boisvert, CBC News, Toronto.
I think it is important that kids know that Christmas is not canceled. Christmas will not be canceled, and we are working on a way to make sure that Santa Claus can still come to town.
Bah humbug. Okay, some good news there following a not so joyous announcement. The city says all city-led and city-permitted outdoor events up to December 31st are canceled. That includes the annual Toronto Waterfront Marathon, Halloween, and Christmas festivities, as well as New Year's Eve at Nathan Phillips Square. Now, some organizers are considering online events instead. The city says it's repurposed previously approved grant funding to create a cultural festival recovery fund. It will provide more than $550,000 of support to festivals impacted by the pandemic. Stay with us. We'll be right back. This week marks 8 months since Canada's first confirmed case of COVID-19, and since then, the country has recorded almost 150,000 infections. Dave Seglins is part of a CBC News team that has been studying data from every one of them.
Beyond rising numbers, just who is getting sick, or winding up in hospital, or dying? CBC crunched the data from the Public Health Agency of Canada, which reveals major growth among young people. Where early on most cases were among the elderly, by early summer, cases involving 20-somethings surged, and they now outnumber all other age groups. And with back to school, cases are on the rise as well among children and teens. In the last month, nearly 5,000 positive tests in this youngest group, which now makes up a tenth of all known cases. Yet as infections grow among young people, it remains those over 50 who are more likely to wind up in hospital or ICU, also more likely to die from COVID-19 or need a longer recovery time. We also looked at symptoms. Sore throat and runny nose showed up more often in less serious cases, while people who wind up in hospital or die more frequently report shortness of breath, fever, and weakness. There are gaps in this data. Some of the official numbers lag weeks behind, but as case counts climb, these government numbers offer the best, most recent snapshot available to help track the virus. Dave Seglin, CBC News, Toronto.
That is our show for tonight. Thank you for joining us. We'll see you back here tomorrow at 6. Next up, Prime Minister Justin Trudeau addresses the nation.